Imagine for a moment that you're standing in your own bathroom, looking at your medicine cabinet. For most of us, that little cabinet is a place of comfort. It's where we keep the things that help us get through the day, the pills that quiet the ache in our knees, or the tablets that settle our stomachs after a heavy meal. We trust these bottles because they're common, they're often recommended, and they've been in our lives for years. But what if I told you that some of those very bottles might be working against your heart in ways you were never warned about? Now, I don't want you to panic or start throwing things away, but I do want you to be aware. Because as we move into our golden years, our bodies change, and the way we process medication changes right along with it. Something that was perfectly safe for you at 45 might be putting an unnecessary strain on your heart at 65 or 75. I'm Wesley Harper, and in today's video, we're going to have a heart-to-heart about 5 very common medications that many seniors take without realizing they could be weakening their heart muscle or disrupting their cardiovascular health. We're going to look at why these happen, how to spot the warning signs, and most importantly, how you can have a safe, productive conversation with your doctor to find better alternatives. If you've ever felt a sudden shortness of breath, unexplained swelling in your ankles, or a heart rhythm that just felt a little bit off, please stay with me. What we're discussing today isn't about fear, it's about empowerment. It's about making sure that the tools you use to feel better aren't quietly taking something away from your long-term health. Now, before we dive into the first medication, I want you to understand something very important. Your heart is an incredible organ. It has beaten millions of times to get you to where you are today. But as we age, the heart muscle can become a bit stiffer, and our blood vessels aren't quite as flexible as they once were. This means our margin for error is smaller. A medication that causes a small amount of fluid retention might not bother a young person, but for someone over 60, that same fluid can be the tipping point that leads to heart failure or a spike in blood pressure. This is exactly why we need to be more mindful now than ever before. Let's start with a group of medications that are practically a staple in every American household. I'm talking about NSAIDs, non-steroidal anti-inflammatory drugs. You know them as ibuprofen, naproxen, or diclofenac. If you have a bit of arthritis in your hips or a lingering ache in your lower back, these are likely your go-to solutions. They are wonderful for taking the edge off pain, there's no denying that. But here is the part that often gets glossed over in a quick doctor's visit. When you take these regularly after age 60, you might be putting your cardiovascular system under a level of stress it just can't handle. I remember a gentleman I'll call Robert. Robert was in his early 70s, a retired engineer who loved his morning walks and spent hours tinkering in his garage. He had some chronic knee pain from years of activity, so he took a standard anti-inflammatory pill every single morning. He felt fine for a while, but then he noticed something strange. His shoes were feeling tighter. By the end of the day, his ankles were swollen, and he felt winded just walking from the living room to the kitchen. When he finally saw his doctor, he discovered that his heart was struggling to keep up. The culprit wasn't a new disease, it was the daily use of that safe pain reliever. You see, the way these medications work is by blocking certain enzymes to stop inflammation, but in the process, they can interfere with how your kidneys handle salt and water. Imagine your heart as a water pump. Now imagine if suddenly there was way more water in the pipes than the pump was designed to handle. The pump has to work twice as hard to move that fluid. For an older heart, that extra workload can lead to fluid buildup in the lungs or legs, which we call heart failure. On top of that, these medications can constrict your blood vessels, which pushes your blood pressure higher. And here is a real kicker. If you're already taking blood pressure medication, some NSAIDs can actually cancel out the effects of your prescription, meaning your pressure could be skyrocketing while you think you're protected. Now, I'm not saying you should never take an anti-inflammatory, but the goal is to use the lowest dose for the shortest time possible. If you've been relying on these daily, I want you to ask yourself, is there another way? Some people find a lot of relief with gentle movement, like water aerobics or Tai Chi, which supports the joints without taxing the heart. Others find that omega-3 fatty acids, found in walnuts or salmon, help manage inflammation naturally over time. I'd encourage you to ask your doctor, Is there a topical gel or a safer alternative like acetaminophen that would work for my specific health history? And this leads us to something even more surprising. Stay with me here, because this next one is a bit of a paradox. We're talking about proton pump inhibitors, or PPIs. These are the medications like omeprazole or lansoprazole that we use for acid reflux or heartburn. Many of us take these every morning as a ritual to protect our stomachs. The irony is that the very medicine used to protect your stomach lining might be opening a back door to heart issues. Let me tell you about a woman named Martha. Martha is 68 and had struggled with reflux for years. She was on a PPI for nearly a decade and felt great. No more heartburn. But during a routine checkup, her doctor noticed her heart rhythm was slightly irregular. When they ran some blood tests, they found that her magnesium levels were dangerously low. Now, magnesium is like the conductor of your heart's electrical orchestra. Without enough of it, the heart can lose its rhythm, leading to palpitations or more serious arrhythmias. The problem is that PPIs reduce stomach acid. While that stops the heartburn, that acid is actually necessary for your body to absorb minerals like magnesium and B12. When you suppress that acid for years, you can develop a deficiency that leaves your heart electrically unstable. Some research also suggests a link between long-term PPI use and a decrease in nitric oxide, which is the molecule that keeps your arteries flexible. When arteries stiffen, the risk of a heart attack can increase. Again, I am not telling you to stop your medication today. Stopping a PPI abruptly can actually cause a rebound effect where your acid levels spike. Instead, I want you to have a conversation with your healthcare provider. Ask them, have I been on this long enough? Can we try a slower taper, or are there lifestyle changes that could replace this medication? For many, things as simple as eating smaller meals, avoiding heavy foods 3 hours before bed, or elevating the head of the bed by a few inches can significantly reduce reflux. It's about finding a balance where you aren't trading your stomach comfort for your heart stability. Now, if you're finding this information helpful, I'd love for you to do me a small favor. If you feel that this kind of clear, honest health education is something you need more of in your life, please consider subscribing to the channel. My goal is simply to help you navigate your health with confidence so you can enjoy your years to the fullest. And if you have a friend or a sibling who takes these medications, perhaps share this video with them. It could be the start of a conversation that truly protects their health. Let's move on to number 3, and this is one that catches people off guard because it's usually only used for a week or two. I'm talking about oral decongestants for the common cold, specifically those containing pseudoephedrine or phenylphrine. We've all been there, a stuffy nose that makes it impossible to sleep, so you grab a cold remedy from the pharmacy shelf. But for a senior with high blood pressure or a sensitive heart, these magic pills can be like throwing gasoline on a fire. I remember a retired teacher named Evelyn. She was 75 and generally very healthy, though she managed mild hypertension. She caught a nasty winter cold and took a popular decongestant to help her breathe. By the second day, she felt like her heart was racing a mile a minute, and she had a splitting headache. She ended up in the urgent care clinic with a blood pressure reading that had spiked to dangerous levels. The reason this happens is that decongestants are vasoconstrictors. Their job is to shrink the blood vessels in your nose so you can breathe. But the medicine doesn't just stay in your nose. It travels through your entire bloodstream, shrinking blood vessels everywhere. Imagine trying to push water through a garden hose, and then someone steps on the hose. The pressure builds up immensely. That's what happens in your arteries. Your heart then has to pump with incredible force to push blood through those narrowed vessels, which can trigger a dangerous spike in blood pressure or even cause an irregular heartbeat. If you're over 60, the risk often outweighs the reward of a clear nose. There are much gentler ways to handle a cold. A simple saline nasal spray, a warm humidifier in your bedroom, or even a warm compress over your sinuses can provide relief without putting your heart in the line of fire. Always check the label for pseudoephedrine, and, if you see it, maybe put it back on the shelf and ask your pharmacist for a heart-safe alternative. Now, we're getting into a more delicate topic, but it's one that deserves our attention. Certain older antidepressants, specifically the tricyclic antidepressants like amitriptyline. Now, let's be very clear, mental health is just as important as physical health. Depression and anxiety are significant risk factors for heart disease, so treating them is absolutely vital. However, the type of treatment matters. Tricyclics were the gold standard for a long time, and some are still prescribed today for chronic nerve pain or sleep. But in an older body, these drugs can be tricky. They can cause something called orthostatic hypotension, which is just a fancy way of saying your blood pressure drops suddenly when you stand up. For a senior, this doesn't just mean a bit of dizziness, it means a high risk of fainting and falling, which can lead to fractures. Beyond the falls, these medications can sometimes accelerate the resting heart rate or interfere with the heart's electrical impulses. This puts a constant, low-level stress on the heart muscle. The good news is that medicine has come a long way. There are newer classes of antidepressants and pain medications that are much kinder to the cardiovascular system. If you or a loved one is taking an older tricyclic, it's a wonderful time to ask your doctor, given where I am in my life now, is there a more modern alternative that would be safer for my heart rhythm and my blood pressure? And finally, we come to number 1. This is perhaps the most debated topic on the list, but it's one I feel a responsibility to share. I'm talking about calcium supplements. Now, this might shock you because for decades, we've been told that calcium is the key to preventing osteoporosis and keeping our bones strong. But in recent years, a growing body of research has raised a red flag. Let me tell you about a woman named Linda. Linda was 70 and very health conscious. She didn't smoke, her cholesterol was great, and she took her calcium supplements religiously because she wanted to keep her bones strong. But then, Linda suffered a heart attack. Her doctors were puzzled because she had no traditional risk factors. When they looked deeper into her habits, they began to question the high doses of calcium supplements she was taking. Here is the core of the concern. There is a big difference between the calcium you get from a piece of cheese or a handful of spinach and the calcium you get from a concentrated pill. When you eat calcium-rich foods, your body absorbs it slowly and steadily. But when you swallow a high-dose supplement, it creates a sudden spike of calcium in your blood. If your body can't use all that calcium for your bones immediately, it has to go somewhere. Some research suggests that this excess calcium can deposit itself in the walls of your arteries. This is called arterial calcification. It makes your arteries rigid and stiff, which can contribute to the formation of plaques and increase the risk of a heart attack. Now, if you have diagnosed osteoporosis, the benefits of a supplement might still outweigh the risks, and that is a decision only your doctor can make. But for many of us, we can get all the calcium we need from our diet. Think about Greek yogurt, fortified almond milk, sardines, or dark leafy greens like kale and collard greens. These sources provide calcium in a way that your heart can handle. I encourage you to look at your supplement bottle and then look at your plate. Can you get that nutrition from food first? As we wrap up today, I want to remind you that the goal here isn't to make you afraid of your medicine cabinet. It's to make you a partner in your own healthcare. Your heart has worked hard for you for decades. It has carried you through every joy and every challenge of your life. It deserves your protection and your advocacy. The most important step you can take today is simple. Do a medicine cabinet audit. Take a piece of paper and write down every single thing you take, not just prescriptions, but vitamins, over-the-counter pain relievers, and herbal supplements. Then, at your next appointment, bring that list to your doctor. Don't be afraid to ask the hard questions. You can say, "Doctor, I've learned that some of these medications can put a strain on the heart as we age. Looking at my history, are these still the best options for me? Are there safer alternatives we could try? Or should we be monitoring my blood pressure or magnesium levels more closely?" Remember, a good doctor will welcome these questions. They want you to be healthy, and they want you to be informed. Every medication is a balance of risks and benefits, and that balance shifts as we get older. By asking these questions, you are ensuring that the balance stays in your favor. Before I go, I'd love to hear from you. Did any of this surprise you? Have you ever noticed a side effect that you later found out was linked to a medication? Please share your experience in the comments. Your story might be exactly what someone else needs to read to feel less alone or to be prompted to call their own doctor. We are a community here, and we look after one another. If you found this video helpful, please give it a thumbs up and subscribe to Senior Health with Wesley Harper. It helps me keep this channel running and allows me to reach more people who are looking for honest, warm, and practical health advice. Take a deep breath, be kind to yourself, and keep taking those small, steady steps toward a healthier you. I'll see you in the next video. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making changes to your medications, supplements, diet, or health routine.